It affects millions of Americans and has made a fortune for pharmaceutical companies. We're talking about back pain. Oh boy, I've been going through that. And here with a naturopathic or a natural approach is naturopathic, can't say all that, naturopathic physician Dr. Theresa Ramsey. You know, I suffer from that. A lot of my friends do. And, you know, sometimes it seems like the only thing is to start loading yourself with all these medicines, and I don't want to do that. I don't want to do that, but I do have it every day. So what are some of the, first we have to figure out what's causing it.
Well, oftentimes it's posture. You know, it's how we're sitting or how we're standing or how we're working on the computer. So that's one thing you want to be really aware of is your posture. Because what happens if your posture is off is your muscles have to compensate, and then your muscles get tighter on one side and shorter on the other side, and then you end up with this chronic pain. Working it out with massage is a great thing because all the muscles start to relax. But what happens is when your muscles are in spasm, it pulls your whole spine out of alignment, and then you get pinches on your nerves. So, for example,
that would be me.
Let me use your hand for okay. So this was one of your backbones, right? Then you have a disc, then you have another vertebrae, then you have a disc, right? So what happens when these start getting out of alignment, that's where all of the nerves are coming out of, and that's what pinches them, is when those muscles are tight.
So if you put a baseball like I do on one certain area back here and you can feel that ting, that's probably what it is?
Right, and what you want to do is let it soften, soften, soften so that the muscle relaxes and stops pinching the nerve. In fact, the sciatica nerve that goes down right back, the backside and down both legs, goes through this muscle, and if that muscle's tight, it's going to squeeze it and cause pain. So it's relaxing all of those muscles.
Can somebody use some of these natural things that you brought to totally ease the pain, or do you have to go through a more chiropractic approach?
You can use things to get rid of the pain. If you suppress pain too much, what happens is you can injure yourself again. That's why, I mean, I will prescribe pain pills, I will prescribe muscle relaxants, but you have to be careful because all of a sudden you have this confidence and then you can move your back in a position and tweak it again. So there are things that can rehabilitate the strength of your spine. So what we're going for is on your spine that bends forward, backward, side to side, there's ligaments on all sides. If those ligaments become weak for whatever reason, I'll give you some examples, the discs begin to bulge a little bit, and that's when people get the disc bulging and the herniation. So the main thing is keep those ligaments strong. And those ligaments are built up of amino acids, and again, if our digestion is compromised, we're not getting them, all of a sudden everything starts to get weak and we become having chronic back pain like that. So
yeah, it seems like everybody, like after a certain age, everyone seems to have it.
Right, right. And I'm going to go back to the, good old fish oil. I can't talk about fish oil enough.
I'm on it. So
yeah, and there's two ingredients in fish oil. There's two ingredients. One is EPA and one is DHA, as you can see on the bottle. The EPA is the anti-inflammatory portion. So if you're getting a fish oil for pain, you want to make sure there's more of the EPA in there, like the 6-to-1. There's 6 parts to 1 part of the EPA DHA.
Is this what people refer to as omega-3s? Okay.
That's one form of omega-3, but the EPA is the it works almost, I would say, as well as an aspirin without the suppression.
Okay, so I've been taking these, I'd say, for the past 2 weeks. So that is one way to kind of start.
It's going to take a while. It's going to take a while.
Okay, so that's one thing to start.
And you know what I've noticed too, besides taking things to help you feel better, we want to take away things that may be causing the problem. And what I find is with a lot of bodybuilders, for example, who use specific protein powders, whey and casein, they are so inflammatory in some people, they break those ligaments down and they end up with back problems. So the first thing is, before you put something in to treat it, take away something that might be weakening your back as well.
Okay, right? So the protein powders could cause inflammation.
That's right, right. And that could be, we do food allergy testing, and so many times whey comes up and they take whey 3 or 4 times a day to strengthen their muscles.
Is there any other foods that we're taking that are inflammatory?
Like the sugars are inflammatory. The whey, and for bodybuilders in particular, casein is another one that's a big one. Processed foods are very inflammatory on the body. So we go back to shopping the perimeter of the grocery store.
Sounds like you're talking more about, having good food habits to kind of offset some of that.
Right,
what are some of the other things about that are natural?
This is something that is wonderful in the health food store called trauma, like trauma, eel. And they're homeopathic, which means you dissolve them in their mouth, they taste like sugar, and they're anti-inflammatory as well.
What are those called here now?
It's called Traumeel, and there's also a cream that you can rub on, that people love, that you can rub on as well. Traumeel cream, Traumeel tablets, on wherever the sore spot is. If it's on your lower back and you rub that on morning and night, it can make a big difference.
Okay, I like going more natural. Does it have that smell? Like
There's no smell to it. There's no smell.
I hate those ones with the, no smell. I like that.
Another common one that's sold is Wobenzyme, and has a picture of the musculoskeletal body. I'm not sure if you're getting that really well. And these are taken on an empty stomach to break inflammation, to cut the inflammation that's causing the pain in the body.
Now, what about all the hype about glucosamine and
Glucosamine, chondroitin are good for joints. That's actually bony surfaces.
Okay. How do you know if it's which of the two are giving you the problems?
If you have a muscle that responds to the ball like you're laying on, that's muscular.
You know it's muscular.
If it doesn't go away, then it's probably a bone. Okay. But then we want to know if it's a disc also. I mean, there's so many different things that it could be. And the most important thing you could do to help your back, besides having good posture, is to strengthen your back.
Okay.
But the thing that keeps our back aligned is our stomach.
Right.
So people do sit-ups to heal their back pain. And there's one exercise, I don't know if you'd like me to show it to you.
Okay, we'll get on to the dirty floor.
Quite
hey, Bob,
simple.
we're moving out. Sorry, guys. We're surprising everybody here.
Yeah.
They're like, where are they going?
It's really a simple exercise. And what I want you to think the whole time when I'm teaching you this exercise is there's a string that goes from your belly button to the back of your spine, and it's pulling your belly button back.
Okay.
Because your belly has to do all of the exercise.
Yeah, they always say when you have back pain, do exercise. Like, yeah, but it hurts.
Right, and this is simple. It's a static exercise. So you want to get on your knees.
All right.
And hands, right? So your hands are right underneath your shoulders.
Okay, here we go with the shots again. Okay, gotcha.
Okay, hands underneath your, and put your feet back and straighten both knees. Knees are locked.
This is called the
plank.
Plank, yes, right.
Now go down onto your elbows.
Without.
Keep your, now keep your butt, okay. Now use your belly button, feel that string pulling your belly button to the back of your spine.
Yes.
Keep your head up.
Oh, okay,
breathe,
I'm watching you.
Breathe. And you want to keep your body as straight as possible until you can't.
And that helps your back?
That's right. You feel the strength in your stomach, pulling back.
Yeah, my stomach.
Back, and that's going to support your back. So if you want to hold this until you just can't hold it anymore.
And now I'm looking how dirty our floors are. Okay, I'm done.
That's all
so that one exercise can help strengthen that back.
If you do that morning and night and you just really strengthen your core, you're going to protect your spine.
All right. So if somebody does have chronic back pain, should they go get an x-ray and do all that stuff for see if there's something more serious? And
yes,
if they can't, because I know a lot of people go, we can't find the source. We've done this, we've done x-rays, and I don't know what it is.
Oftentimes it's not pathological yet, it's functional, meaning something functional is going on, it's not showing up as pathology. But yes, I do think working up the spine is an important thing, because if you have a herniated disc, you don't want to mess around with that.
Okay. But if it's somebody like me that just has constant kind of that lower back, and you sit on the ball and then it goes away and it comes back, that's probably more of some of the stuff you talked about.
It's just posture, it's taking anti-inflammatory nutrients, it's getting enough rest, it's eating foods that are good for your body.
And remember what Dr. Ramsey always says, shop the perimeter of the grocery store, which means the veggie aisle. Don't go in those interior aisles, stay around. And you know what? I've gotten a lot better at that.
Yeah, it gets easier and easier, doesn't it?
It does. I hardly ever go in the middle aisles anymore.
Great, great.
I'm getting much better. Thanks, Dr. Ramsey.
You're
Good
welcome.
stuff to know. And you can go to our website to find Dr. Ramsey's website, and you'll have all the information on some of the stuff we just talked about. If you want to try that first before you go more extreme measures, try that. And I like what you said about the posture. We can stand up. I figured out what was wrong when you said it's probably your posture. I always stand like this, my feet. And now I'm trying to correct it, so sometimes maybe it's just a bad habit.
Yeah, just a bad habit, getting to know what your body's doing all the time.
All right, thanks, Dr. Ramsey. Good stuff. Coming up next, we're going to see how you could save money at the grocery store. We were just talking about that since dairy and eggs and everything's going up. So we'll be right back.